There we
There
go.
we go. All right. Now the hair's out of the way so you can see.
Okay. Let's scoot a little closer.
Yeah, I think so too. Maybe right here. Is that close enough?
Yeah.
Okay. And I can
Okay.
I can take this out and turn this down so they can see better even.
Yeah.
There. You can do that.
I'm waiting for your husband to come back.
Oh.
The collarbones are kind of leaving.
Isn't that interesting? That's probably the shoulder. Wow.
What's he doing?
I don't know. Opening something?
Yeah.
Oh, he's setting up video also. Look
Yeah.
at that. Very cool. Okay. Oh, I didn't know I was going to be a movie star.
So I am wearing gloves because, is it okay if I tell him you're type 1 diabetic?
Yes, that's fine.
Because she is an insulin dependent type 1 diabetic and she has a lot of insulin in her body. And whenever I work on somebody with a lot of insulin, my blood sugar drops. And so I've learned to wear gloves to keep me from picking up their insulin.
Got it.
And so you don't have to wear gloves, but
That's why she does.
yeah. So this is the collarbone right here.
Mhm.
Okay.
I'm gonna go right above the collarbone. And there's kind of a little soft place there. Right above the collarbone. Now, I want you to notice her left and her right shoulder in comparison, because my guess is when you're on her right shoulder and you're kind of sinking down in that space above the collarbone.
Needs to be a little higher above the collarbone.
Yeah, you want to be in that soft area
Above the collarbone. Yeah, not on the collarbone, right above it, because you're going to sink down right under the edge of the collarbone.
Okay, do you press hard or? soft?
Well, yeah, it
Innovative
soft to
therapy.
start with. She's been doing this to me for almost 20 years, so I've learned a little. Yeah, but you're gonna go in and go down, and it's soft to start with, and then once you get really going, then when it starts to loosen up a little bit, you can go a little deeper.
Right. So collarbone right here. I want to be so you can see a little bit about how far I'm moving my finger above the collarbone.
Can you see?
Collarbone here.
You can draw marks
Above.
on me if you want to show where my collarbone is.
Okay.
Do that, then he can see better.
I mean, should the bottom of my fingers be feeling the collarbone at all or no?
No, you should be above the collarbone, and your fingers should not be this way. They should be this way. There you go.
So we got the collarbone.
I'm an old teacher, okay? I don't know if they can see that. I can't see it.
Yep, we can see it.
You can see it? Okay.
Okay. So the lines are just on the collarbone, and see how I'm above those lines? Right in here. And as I sink into the tissues, I'm only going until I feel resistance. So I'm not pushing into the resistance. I'm just gonna sink, and right there I get resistance, and then I'm gonna just release it. So I'm just gonna sink, and then I'm gonna release it.
You actually slide just a little forward when you do that.
Yeah, so the movement, I'm gonna make it big. It's kind of like this. But this is huge compared to the actual movement that happens on the body.
Yeah.
There you go. Yeah. I can
And it
feel
should
that.
feel light. Like one of the things I get told a lot when I'm teaching this, and when I show people what it feels like, they're like, it kind of feels like you're not doing anything. And I'm like, yep, then you get it, then you've got it right. Charmaine is got redhead, and I'm using light enough pressure that she's not turning red. And redheads turn red if you blow on them.
Okay.
So as I do this little stretch, I'm really thinking kind of a stretch or depression, very, very gentle into those tissues. And it should feel comfortable to the person that you're working on, Mark.
Yeah, you're stretching the skin as you go. You're not on top. You're not moving across the skin. You're moving into the skin.
Charmaine's had a lot of sessions with me.
Yeah, I told her she's been doing this to me for almost 20 years.
That's true, I have.
Yes. I'm one of her miracles.
Yeah.
So as I'm going down and in, so Mark, what I want you to be noticing is compare you the right and the left. Does one side feel softer and more able to receive that stretch? Does one side feel firmer, harder, more full?
I think the right side feels softer.
Okay, that's interesting, but
It feels a lot tighter to me, but I didn't want to say anything to change. I can just feel like, oh, feels good.
Yeah, it does.
so
doesn't
the
it?
tendency, and I this makes me cringe, please do not ever do this, is to go, I've seen people do this. Oh,
Oh,
if I
no, no,
push
no.
harder, it's going to release that tightness. The opposite is actually true. If I'm feeling one side that is like, got more congestion, I may actually stop working on one side and just focus. So I'm really feeling the one side. And I'm really feeling the tissues like, okay, right there, we get some tightness and I back off.
How long do you hold it if you hit the tightness?
About 4 seconds.
Okay. I feel a pulse on her right side in my index finger.
Well, and that could be the pulse in your index finger.
That could be.
Yeah.
So the other tendency we have, again, is getting more force. I've seen this happen way too many times where people get out their elbows and start digging. And the other thing I see is, let me push really hard with my fingers because that'll happen faster. I promise you, I've been doing this about 20 years, 22 years actually. And go lighter is the answer. When you feel like, man, there's a lot of resistance there,
Why don't I try
you can hold it for those 3-4 seconds and release it.
Okay.
And then let the body work it. Because I mean, Charmaine's neck, and I just, by the way, I hope she doesn't mind,
No,
but I
it's
just
fine.
finished a session with her. And I'm still feeling how much
It's been a long time since I've had any lymphatic therapy because she moved away from me.
Are you using your thumbs at all?
not really. I have them like this on the back of her neck, just as
Resting.
a rest, but I'm not using them. So I'm just going down and going in. Going down, kind of in. So when I say in, I mean inside the body cavity where the lungs are.
Not going down.
Kind of under the shoulder bone.
It would be under the collarbone, and it would be kind of in between the collarbone and the shoulder blade.
Mhm.
And I will tell you, this place in the human body is so important to getting the lymphatic system moving. If we learn nothing else, it is
Okay.
worth it to do this, but we're going to learn more stuff. But that's how powerful this is. I have literally seen people
Okay.
just change the way they walk by doing this. And this is the only thing that was done.
Okay.
And the way that they walk started to change. Now, was it going to get all the results you wanted? No, it wasn't. So now I can feel she has a tight place right here.
Mhm.
And so I'm going to take one finger, I'm going to focus on that mentally and physically because I'm going to really listen to that band of tissue and go, okay, it will go that far and it will go no more. Now it goes a little further and it will go no more. And when it goes no more, I don't push it. I say, I respect your need for me to stop right there.
Okay.
So instead of pushing it, and that tends to be the way we're taught and the way that we do things, is like, let me push harder and it will do better. It doesn't, I promise you. 22 years of doing this. You respect where the tissue says,
Yeah, there's no force in any.
where the tissue says, okay, can you feel that into your ear right
Mhm.
there? Okay,
Mhm.
because I can feel the pull going all the way up her
Mhm.
neck into her ear.
Mhm.
And
The
I'm
pull-
doing just a little hold, and the tissues are going, oh,
Mhm.
thank you for not beating me up, lady. I love you.
But the stretch is wonderful.
So it's a very gentle, it's almost like asking the body and the cells, because, you know, cells are divinely created. We did not make them, by the way. We just think we do. And so when we can really listen and respect where the cells are guiding our support for them,
Okay.
Now she's pushing a little further forward because
It
it's
changed
allowing her,
direction.
yeah, it's allowing her to do that now. It was too tight earlier, I could tell.
yeah, and it's changed direction. So I was kind of going in, and then it started coming out, and then it went in again.
She didn't
So-
learn this in one day either, by the way.
No, I didn't learn this in one day. It took a lot of practice. So again, on her right side in this area, I can, when I sink, I go that far, and then the tissue says, that's it, lady. I'm not letting you in further. So I'm not pushing in. I just feel that that tension in the tissue. And then I just follow it. So if you watch my fingers, the movements are kind of small.
Do we need to get closer still so he can see that small movement?
I don't know. Can you guys see that, or do you want us to get closer to the camera?
I can put you on full screen.
I think we need to be closer because he was looking real hard.
Okay, scoot closer.
Yeah, let me scoot closer.
Okay,
'cause
I
he
got
was-
you on full screen now.
Oh, but is that okay then? Okay. Oh, that's better. I can tell that now. Okay.
So this is already much softer, but there's still a place right here. So I'm using the padded parts of my fingers,
Okay,
and I'm coming in. And I'm just sinking until I find that muscle that's tight.
That's where it's tight. Yep, right there.
And then I'm just following it. Like you might follow when you were a kid, if you ever, turn the sprinkler on and followed the water as it ran down the street or ran into the gutter, or
Right.
so which way are you following?
whichever way it draws me. So the tissues, when I'm on the tissue and I sink into it, so watch these fingers because I'm sunk onto a tissue and it's pulling me out this way. And now it's arcing me down this way. And the movements are small enough that they're very difficult to see.
Yeah, and she can feel it, and she can feel it moving in directions, and she can probably even tell you, okay, so now you can go down a little bit, now to the side a little bit, and help you know until you get accustomed to it.
Well, and the other thing is, in the beginning, people are like, but what if I'm doing it wrong? You're not. I promise you're not. Even if you think you are, you're not.
You're fine.
Because the body is leading you and you're allowing that to happen. And it's just like any relationship on the planet. I don't care if it's with a cat or your spouse or your child. If you're striving to recognize what that other being is,
You're doing good.
you're doing it right. And as you continue to spend a few minutes here and there doing this, it will become more and more clear to you.
Mhm.
Is it possible that my neck is really tight?
Oh, I'm sure it is tight.
But remember, you're working with the lymph, not the muscles. And it's two different tightnesses.
Well, and usually the muscles are tight because they're swollen with lymph.
Yeah, well,
So
that's right.
when you can open up the lymph,
Then the muscles loosen.
then the muscles start to relax and soften. Okay, so now I'm above the collarbones again because I want to just do a few little stretches in. And when I say in, I mean I'm going inside the body behind the collarbone. And I'm just stretching to where the skin, where that skin on top of the tissue underneath, you feel a resistance, and then I hold and then I release.
And she's doing it harder on this side than this side. It's not the same.
That's because this side is tighter. It's giving me more resistance, so I stop sooner.
I feel it on my left side tighter, so maybe the right.
And see, it's probably good that Charmaine is here to interpret because I've done this for so many years. Sometimes it's so innate in me at this point that sometimes I forget to explain things because I just think everybody knows what I know, you know, and
And the teacher and me can't stand not to.
So hold it for 4 seconds and you get the resistance. Yeah.
And I don't usually count to 4. I've done this so long that I just kind of feel it. As to like, okay, because you can feel this tighter. And so on the side that is tighter, I'm using less pressure. And again, you notice she still isn't turning red because I'm not pushing on there. No, and Jennifer isn't turning red either.
Right.
Okay. So there's a muscle that goes from here up to the back of the ear.
Okay.
I want to be outside that muscle slightly.
This is next step.
Okay.
And I want to feel what I'm feeling right and left. Is one side tighter? We're still tighter on the right here. So I may focus just on the right and the left may follow, or I may even not do the left just so I can focus on the right.
Now you're either getting harder or you found a good spot. I call it a good hurt. Sometimes she'll find a spot and it's like, oh, such a good hurt.
You want anything?
Uh-huh. Yeah.
Yeah, talk to me. Give me some feedback.
Okay.
Well, I'm just following until I feel the tissue resistance.
Was on the left. So I think, yeah, just a few seconds.
So the direction here is a diagonal like this, and I'm exaggerating that because again, it's
Right.
so small when I'm doing it, you may have a difficult time seeing it.
I think it's hard to know if he's on the muscle or on the lymphs right now.
Nope, he's perfect.
Okay.
He's right behind the muscle.
Right on the left.
See,
So
that's the
as-
benefit of you being so long and so lean, is that I can absolutely without a doubt see that he is in the right place.
Oh, cool.
And it may not feel the same to you on both sides.
No, it feels different. Sometimes it's the
Right.
left, sometimes it's the right.
That's right. Because this side, what she's working, feels very different from this side.
And some people get a little anxious about, but my injury is my right shoulder. Why would I have pain on the left? Because your left is like the church that brings the casseroles. And they've been bringing casseroles for a while and they're kind of getting like, okay, I can't keep bringing your casseroles and taking care of my family. So we need to get you on your feet. And so the left side has been helping to support issues on the right side.
Right.
And so the left side can also get some issues in it.
And I'm also only sleeping on one side now and using my left arm for so much more of all the lifting and
Exactly. Those are all the casseroles you're bringing to your right side,
Mhm.
because you're like, the left side is doing all this extra work to help out. And the right side is, you know, and we need to get some of this, I call it mopping up. We need to get some of the inflammation mopped up. So if you notice, my right fingers are moving, but my left fingers became stationary. Why? Because I found an issue that I need to work on right here. And so this side is just sitting there for the ride.
And is that issue on that side a little lump, or what is it that you found?
It's a little pond of swelling.
Ah, you can feel the pond. Okay. Like a
Yeah.
little poochy place almost.
Yeah, it's a poochy place underneath the muscle right there.
Yep, I have one right here on the left side too.
Mm-hmm.
Okay. And so then this hand just becomes a resting hand, and I do some lighter strokes on that poochy place, on the pond of fluid. And I just do some stretches here, and I'm focused on how does the body want me to stretch it? What direction does it want me to stretch it? How much pressure does it want me to use when I stretch it? And when it says, yeah, that's it, then I say, okay, and that's all the further I stretch it.
I think it is stretching it. So right now my shoulders are just kind of slumped. Should I be,
Yeah.
yeah, should I be sitting up straighter or really like so relaxed that I'm slumped?
My head's following hers, or she's following mine. I really can't see my head, but that's exactly what I'm doing. So,
Okay,
Just relax. The more relaxed you are, the better
Yes.
it works.
so
Okay.
most of the time obviously I have treatment tables where people lay down. And so but I can't get a camera angle if she's laying down. So we're doing it sitting up.
okay,
So you could do this laying down, like Jennifer could lay on the bed, so your head's at the foot of the bed. You can get a massage table off Amazon for about $100, which, you know, of course, I think
Yeah.
everybody should have. But
the thing with our house is it's so small, it's like, where do you put it?
They do make them that fold up, and you just take it out and stick it
Oh,
in an open, where you usually walk, just stick it there for a while and then fold it back up when you're done.
mine at my condo, because I have one on my condo, I fold it out and fold it back up.
It's not hard.
I think we can see the collarbone. You don't have to grab your shirt if you're.
Oh, okay. All right.
Yep, you got it.
So now I found a new place right here,
It's a little further back.
and it's a little further back. So can
Okay.
you pull up your trap? Do you know how to pull up your trap right here?
Like that?
Yeah, you can, no, you don't have a big trap. Like
No.
elevate your shoulders.
Oh,
Oh, like that. That's what
So
you
there's a
want.
muscle back
Oh, yeah.
here,
You want to show the muscle.
and it's called the trapezius, but that muscle, you want to be sure that, and relax.
Mhm.
So you want to come in front of that muscle and feel. Now it's going to come out here and out here and out here and out here. So that's another line of lymph nodes that you can work on. And again, she's still tighter on her right, because I cannot get nearly as much stretch on the right as I can get on the left.
It's probably because I never had you work on that frozen shoulder.
When did you have frozen shoulder?
2019. It was terrible.
No, I was already living here.
9 months.
That's what they think I might have. They
Oh,
can't quite figure it
I wished for her every day, but I was 500 miles away.
out. I'm about, how far are we? I'm about 2,000.
Oh, wow.
I was thinking somewhere between 2,000 and 3,000 miles, probably.
You are so blessed you have a person who's willing to learn this.
Yes.
So again, when I get up here, I'm going to turn her head, turn her sideways so you can see. I'm up here at the base of the skull, and we have, you can kind of see that line coming down, and I'm
Yeah.
gonna be right in front of that line, okay? As I do those stretches.
Okay. Yeah,
Now, the other thing you could do is if you're like, well, we don't really have a bed that I could like, you know, she can lay on the bed because I can't get in a good position, because the provider needs to be somewhat relaxed. If the provider, meaning the person doing the massage, is tense, this is going to be hard to do. Like if you're like, oh, my back is killing me, get a different position. You have to also be relaxed, or you cannot pay attention to their body because your body's screaming.
right.
So that may mean, finding a comfortable chair that has armrests so your arms are supported, or putting a pillow on your lap so your arms are supported. And not trying to pull them back or do anything with them necessarily, but just so that you don't feel like they're hanging on the joints, if that makes sense. So your arms aren't hanging on the shoulder joints.
For the provider.
Yeah,
No, that's for you, the receiver.
Oh, so that my
You're in a better
arms are,
position.
oh, got
yeah,
it.
you don't, yeah, that's no. They're in my lap right now, so.
Arms.
Like her arms are in her lap, but she is not as tall as you are, because
Mm.
I know your height, you've told me. And so you probably need, may need something in your lap.
Okay, Mark just gave me a pillow.
And how does that feel for you?
Good, more relaxed.
You're working up and he's not working up yet.
No, he's doing
He's still
fine.
doing fine.
Yeah, because he's gonna take longer to feel than I do, because
Yeah.
I've done this 10,000 times in 22 years. He's probably never done this before right now. And so, and your body knows me, so it's like, oh, lady, can you come here? I need you to come right here.
Yeah.
So I'm moving up as your body is directing me. And so we don't necessarily have to be exactly at the same point, because he's looking pretty good. How's it feeling to you, Jennifer?
Yes, it's feeling a lot better.
Okay, good. Now, where did I put my?
Yep, right there. It's tight on the left. Yep, right there.
Yeah, that's tight
Feel
right
it?
there.
So I have a super tight part on the left right now.
Okay.
Yeah.
So
Really?
again, go lighter and take many short, you know, not short, quick, but just many short strokes. I even don't, I really get to the point where I don't bother to count, because it can be so many strokes in one spot.
Okay.
But I'm sure I've done 20 to 50 in one spot.
Cool, maybe lighter. He's hardly touching it, but man, it hurts.
Mm-hmm.
Okay, so show me, I want to get really close to the screen so I can see and put my glasses on. Okay, can you show me the place where it's hurting? Right up there. Okay, and you, Mark, your hand position right now is good, because I was just gonna say you want to go closer to the collarbone than where the pain is. And so your hand position is closer to the collarbone than the pain is. And then, because we want to
Oh.
create a siphon. So the siphon is created, is it that whole length of the muscle, Jennifer, or just way up there?
No, it's,
Okay. So if the pain is up in this area, which is what I'm getting, I'm gonna bring my hand down here, and I'm gonna work with the muscle in this area.
Okay.
Why? Because I want to create a siphon to pull the fluid out of there so I don't have to touch it. Because I work with that all the time, where somebody has such a sore area, they're like, I had one lady and she said, no, you cannot touch me in the whole region of where her problem was. And I worked every place else for several sessions before I was able to move into where, before we had that calmed down enough. So we may not get it entirely calm during the session, but you just know when you come in here on that left side, which would be this side really, but when I'm here working, it may take 2 or 3 times of coming back.
2 or 3 sessions.
Yeah, 2 or 3 sessions of coming back.
Is that so hard?
It really, really hurts. Maybe starting like lower or,
Yep, so if it's really hurting, come out a little further.
We can do this, I don't care.
So there's actually a point where the collarbone and the shoulder blade match over here. And I can even come right here. Ooh, she needs that too. So right here, you can see there's like even a little bulge.
Yeah.
So I'm gonna come on and I'm gonna just investigate that little bulge a little bit.
try both of you.
So when I say investigate, I might just put a little pressure on it and see how that feels for her.
Yep, that feels fine.
Okay, and if it feels fine, I'm gonna really listen to the tissues. And I'm gonna stretch, hold, release.
You stretched back with your fingers, with your.
Yeah, are you moving your fingers forward?
My fingers are stretching forward towards the collarbone and then releasing. Sink to where I feel that the tightness, stretch. That was the tiniest little stretch because it's really, really tight right there, and then release.
This. From here forward.
From here forward?
So
So maybe further back. Forward.
And she's not doing anything
No, she's not.
with that hand.
yeah, this
Just
hand is
resting.
wherever you're comfortable, Mark. So it's fine if it's wherever
Yes.
she's comfortable and you're comfortable.
Like that?
I think so.
Now here, I'm also using the padded parts of my thumb.
Whoa.
Because
Yeah.
this is my 4th consecutive session of manual therapy, so my fingers are a little tired, so my thumbs are jumping in to help me out. But I don't ever use the ends and I don't press, I just use the padded parts to contact the tissue and do that little stretch.
It's very soft.
You're
Very
good.
soft.
Okay. But I think you are at the base of what's going to help.
Yeah, and that's where you want to be. That's the perfect place. Why? Because I want to create that siphon, so I'm pulling the fluid out of this area up here. I'm not trying to squeeze it out or wring it out or beat it up. I want to just say, hey, guys, up here, how would you feel to come to our party down here? And then those molecules up here go, oh, they're having more fun than we are. We should join them.
Let's make a flow.
And so they start to create a flow out of that area. But again, when you're very, very swollen and very, very tense, it can take a number of stretches before, because like she's getting softer. Because the neck was not our area of focus during the session today, but I'm sure it'll help her. So she's happy
I'm very happy.
because I just wanted a body.
I'm very happy.
Hey,
So everybody wins.
that's right.
I have had people where I've shown them on me, but I think it's best when I can show them on somebody else.
Do you want me to turn sideways so that they can see what you're doing there?
Would it help if she turns sideways?
Maybe.
Maybe.
I mean, it looks pretty good.
It
Go
looks
ahead
pretty
and
good what
turn
he's doing.
sideways. So when she turns sideways,
You can
and
see
this
that.
bump is not as big as it was when we started.
Yeah.
And so again, padded parts of my finger, stretch and release. Stretch and release. Stretch and release. Because
Yeah.
all this fluid is going to go inside the body cavity underneath the collarbone.
Very gentle.
And so this is so much softer than it was. Can you tell that?
Mhm.
It's much softer than it was when I started.
I can even move my neck better.
But again, she doesn't have a shoulder problem right now.
And then he's gonna like continue up toward where the pain was, or
this feels nice and soft, if this is feeling, gets pretty malleable, then yes, he can travel up here, being very aware. This is important for Mark to be very aware that it's like, oh, that's tight here. Now the pain might be right here. So the pain's here, and he goes, this is pretty tight right there. So I'm not going to go all the way up to the pain. I'm going to continue saying, you know what? Let's just give you some support and stretching right here. And you can literally see that finger move, I think. I'm not moving it. I'm
Oh, right.
stretching with these two fingers,
Yeah, okay.
and it's just creating the movement in the tissue up there. Now, again, her pain place is in her neck, at least not today. I
Not
worked on her
today.
neck plenty.
Mm.
But
It's been 4 months of trying to.
okay,
It says I'm really tight, and I'm explaining it's 4 months of trying to live with a really bad shoulder.
Yeah,
yeah,
I understand
so,
that.
and it can take a lot of repetitions. So what I want to do is move forward into doing the armpit, because I think you have the concepts of the neck going and under. Do you feel like you're comfortable with those, Mark?
Yes,
Okay, so go ahead and turn back straight.
Okay.
Now, I would start with her left arm.
let me stop the video. Start.
Why would I start with her left arm? Because now I have my foot, scoot over that way.
Mhm.
So I have my foot on a stool, and I'm gonna put her arm here so it can rest. And when you feel the armpit, you got this front wall right here that I can grab, but I'm not grabbing it hard.
No, she's not.
And so you want to come in behind that front wall with my padded parts of my fingertips, and I'm just going to do a press and notice what I feel, and then a release. And then I'm going to do a press and a release.
Is it okay that my elbow is cocked?
Yeah.
Mhm.
Yeah. So what I'm feeling, Mark, and what I'm looking to feel is, where are there tight places? Where are there restrictions? And you can see she's got a tight place right there, right?
Mhm. I always have a tight place there.
Yeah, that's scar tissue.
That's scars. Mhm.
So I didn't go right in on that scar and start digging on it, right? So if you see a tight place, I'm stretching. I'm gonna make this movement big. I'm stretching like this. So my thought is I'm going up and into the body cavity through the armpit. Make sense?
Creating the flow back to the body. Right? Oh, that feels good.
So as I'm creating that flow back into the body, and I'm just trying to keep my thumb out of the way so you guys can see my finger movement. I'm only going and stretching as far as her tissues will allow. Because sometimes we have this idea, and here I'm using the side of my finger, and I can still go into the armpit. Now, if she were laying down, I sit right here. I'll sit on a stool here and I hold her arm like this underneath my arm.
Mhm.
But if I'm sitting up, and I do shoulder sitting up a lot, I put their leg on my arm just so that they can feel relaxed. And I feel like I've got some control on where I'm going here with the arm.
Okay.
So as I've done this, you can see that that tissue is now moving more. And I'm able to take a more of a stroke.
Yeah, he is too.
Now, I realize this is not your injured shoulder.
Right.
This is done very intentionally because people say we're on the wrong arm. I'm like, no, we're not. It's not like we're doing surgery.
Right.
The reason why we want to use our best arm first is because the lymphatic system is a one-way valve fluid transport system. So when you increase the flow, any place in the body, you've increased it every place.
Oh,
So when we use the less painful side to learn on, it's less painful. We like less painful. But it also gives us a comparison to go with. Now I'm gonna have Charmaine turn around backwards. This is so much easier to do when I have a
With a real
body.
person? Like this. Is this what you want?
Yeah. Okay.
I am not shy. It's, you know, whatever you want to do.
Okay. So I'm again gonna position her arm like this because now I have the posterior wall or the back wall of the armpit.
push back.
And I'm gonna do this coming into the back wall and going up into that body cavity. And if I follow that back wall, there's actually what we call the apex of the axilla, or it's like a hole in the armpit. It's way up in the middle. It's like up in here, but it's on the inside. So this hand you can't really see because Charmaine would have to stand on her head.
That might be interesting.
So I'm drawing this fluid up into that. Now, if I hit that apex, that right up in the middle area, and the patient goes, whew, that's tender, that really is sore, less pressure, because we're probably gonna find that on the other axilla, okay?
So,
But are you feeling it?
yes. I mean, I don't feel tightness, I don't feel pain.
Mhm.
Good, then he's doing it right. So again, as I've done this, you can see her arm's gotten softer than it was in the beginning.
So what's holding the arm up?
My leg,
Well,
That's-
I just moved my stool over and put my foot on the stool so that I could hold her arm up. So I have a bench, I have a stool, I have sometimes my own body. I will like hold her arm
Okay.
like this and so I hold it with one hand. I prefer to hold it on my leg because when I hold it on my leg, I have two arms more free to do what I
right.
feel like her body needs.
You feel like you're stretching the muscle, like it gets looser.
So I'm going up, I'm going up.
Mhm.
And you can do these same maneuvers, Jennifer, on yourself, like you told me Mark was leaving town
Mm.
for a few days. So if it's easier, doing the shoulder to me is much easier when you have somebody else to do it, but you can attempt to reach some of these things on yourself the best you can. Okay, so you can see how this is getting much softer through here.
Yep. I think
Okay.
mine-
So once I have that, the better side flowing, and in her case, the better side would have been the other side, but that's okay because we're doing you right now, not her. So I can even come down this way. So I can start as high as this, but I can bring fluid down. Bring fluid down,
Do you
bring
feel
fluid down.
And there's some pressure there, but it's not hard.
Yeah, you notice
Not
her,
deep.
her skin is not turning red. I'm stretching the skin on top of the tissues underneath, but I'm also kind of moving the tissue underneath. But it's not like kneading bread dough. It's more like stretching the saran wrap over the top of your mashed potato bowl.
Got it.
What do you think?
I think that's how she's doing.
So this becomes important because when we get to your other arm, we want to help these muscles reduce their inflammation. Because this is where your cuff starts right here and it comes down here. That's the rotator cuff where you were injured, where the scans say that you have the injury.
Okay.
Maybe talk about that.
Oh, yeah, I have an MRI on Friday.
Okay,
So it'll be
Good.
interesting to see.
well, I mean, they did the MRI when you were not in the United States.
They did an ultrasound and an X-ray, but they have not done an MRI yet.
Okay,
So it'll kind of confirm if that tendon is really damaged like they think it is. I mean, we know something's either damaged or out of place, but we just don't know what. I mean, if that's true.
okay, so now I've got that pretty open. Go ahead and flip around again.
I think that feels a lot better. This side, yeah.
And let me tell you from experience, frozen shoulder, 3 tears, 3 partial tears, back here, here, and here, no surgery.
Thank
So-
you.
Yeah, because, and it took, I didn't have her to help me through it. So
Right.
it took me 9 months. But it will, unless it's torn completely, it will heal itself
Oh,
in most cases.
I
Okay,
needed a word of hope.
it just takes a little time and patience.
Okay, so again, we opened up the front, but we also want to stroke a little bit on the front to open that up.
How important is it that I get it at 90 degrees? Because obviously,
It's not, you can, I actually do patients, let me show you, scoot over again.
Which way? This,
I'll just scoot the chair.
oh, scoot the chair over. This way?
Yeah.
Okay.
Because that way we can be closer to the camera, you get a better picture. Ooh,
I know. It's my, I have my,
is that your reader?
that's my, my sensor for my
Okay.
insulin, for my glucose.
Well, here's what, I just don't want to disturb her sensor.
You can work all around it. Won't hurt anything.
So I will also sit down in a chair next to the person and just hold their arm like kind of into my body with my arm part.
okay, we
So-
put on a upside down garbage can. So
Oh, that's a good
That'll
idea.
work too. Hi. I didn't know I was coming. I had somebody else down, but it will work. No, they canceled, so you're fine. Because I already canceled that, I know. Okay, so again, I'm gonna work first right behind the front wall of the axilla. That's what we call this.
are you going toward the body?
Yes, the stroke direction is always towards the body and towards that apex area in the middle of the armpit. So you can even feel that apex just to make sure that it's kind of got some ability to flow the tissues up through there.
Okay.
Flow that fluid, because it's all gonna go way up into the middle here. Boop.
That feels good. I don't have pain. It does feel tight.
Mhm.
Okay, those are all good things because I would expect it to feel tight, especially compared to the other side, because when you have either these tears or frozen shoulder or whatever, you're gonna have some inflammation in that area.
Yeah.
And so we want to so where the tightness is, we go lighter and just stroke that a little bit.
Yeah. I think
Another spot, isn't it? Mm. Oh, okay, yeah. Mhm, sure. Mhm, mhm, mm.
Whatever that is right there. Can you feel that?
It's tight.
Yeah, feels like a tendon or something.
Just gently stretch it.
Yep, just gently open that up and take the fluid towards that apex in the middle of the axilla, where you go way up there and you go, yeah, I can feel
How
that.
much water should Jennifer be drinking?
Half her body weight in fluid ounces every day.
And after a session, lots of water for several
More
hours.
water, yeah. Innovative therapy. This
And
is
I
new.
want to tell you both intent, I totally believe intent matters.
Hello?
Technique is important, but intent is just as
Hello?
important.
Okay.
So
Innovative therapy. This is Mary.
And you did mainly exercises to get over your frozen shoulder?
I did quite a few exercises. Yeah.
She
went
did
through the-
not do the body power system, however.
I did not. I was not in a place where I could.
So
And she's just gently in and up, in and up.
I'm just contacting the tissue, stretching up towards the apex.
And remind me again, we are loosening the muscles so they're able to get some mobility back.
No, okay, so when you have a lot of swelling, this is a capillary. You have a lot of swelling and this is your capillary. So when we can take the swelling away and let the capillary fluff back up, is like, I don't have a better word for it, but expand, dilate,
Yes, yes.
then I can get healthy blood in there. One, I don't have the pressure on my nerves and my blood vessels squashing them all, and that's where a lot of pain comes from. So I
Yeah.
remove that swelling, and that's what we're doing is removing swelling. Then I can open this up so my body is free to heal itself. And I don't have so much pain because my nerves also went from being squashed to fluffing back up. I mean, nerves don't have holes in
They're
them,
not being compressed
Okay.
anymore.
but they're not being squished.
Yeah.
So when we can open them up by removing the swelling from that arm, and again, you guys can figure this out. You could do a 20-minute session, you can do a 60-minute session. It's, you know, how can we fit this in our schedule? It doesn't always have to be a full hour session, right?
If you have 5 minutes, that's better than not any.
Exactly.
Tired.
And I want to tell you one thing that when you have an injury of any kind, anywhere in your body, there's a massive march to that spot by all of your systems to help
She's a nurse
heal that
practitioner, by
spot.
the way, so she does know it.
I know what I'm
Right.
talking about a little bit.
She is a nurse practitioner.
Yes,
Yeah.
awesome.
Okay, and everything, all your defense systems rush to that part that's injured to help take away bad things that have accumulated and to help bring healing things, but that creates a lot of fluid in that space. And that's what causes the pressure that makes those blood vessels compress. And while it's a really good thing initially, lots of times it just gets stuck there. It doesn't, because you've compressed it, because the fluid went there, it can't get back out.
So notice how I'm
So-
working all the way down to her elbow because your shoulder doesn't stop
That's
right here. It literally goes down to about
This
here.
is working up.
So I come down here and I'm doing some of this going up. Okay,
How much of this can I do on my own?
well, let me run through that super quick.
I can do this. You can do all of this on your own.
So you can do the collarbone. And I'll even do it like this. And then I can go up my neck outside that muscle. So I'm using the padded parts of my fingers and my thumb. And I'm going up to my, behind my ears. Then I'll take my hands and I'll come behind my trapezius.
Can't do that very well with my shoulder. but-
So if it's hurting on that shoulder, I can reach across with the other shoulder, with the other arm.
Okay.
This. Go down like that.
And then since you had all the soreness on the left, I might be able to support here with my hand. So I'm supporting my shoulder and just taking my hand over there. And if I can't reach it, I just can't do that yet. I'm not ready to do that yet. And then in my own armpit, I'll actually put my hand like this and I'll work in my own armpit.
Can't quite do that yet.
Okay.
Do you have a mantle back there? Is that a mantle place I see back there? You could stand up to the mantle place, and put your elbow on that.
I don't think she can get her arm up.
If you
that
can
high.
get it that high, or a counter, if you have a low counter in the kitchen, sit next to the counter or something like that.
Yeah,
even
you
if-
could do our island probably.
Here you go. Mhm.
So here I can come in and I can work on my own armpit.
Okay.
And feel where it's like, ooh, that's a little sensitive. So I'm gonna go a little lighter. I'm gonna do a few extra strokes until it goes, oh yeah, thank you very much for getting me going there. Appreciate it. Okay, and then and I mean, mine's gonna go pretty fast because I do this regularly.
And it's not
Okay.
in right under here, not up in here, but down a little lower, right where the breast goes around to the side. If you find spots that are sensitive right in here, that's not uncommon. Those are little lymph nodes that are trying to help.
Stretch them
And
into
and
the
you may have a
armpit.
sore lymph node.
Into
so-
the
So
armpit.
you take on the outside of it and push it gently towards the armpit. And then gradually that little node will open up and the flow will go, that little node's swollen. And then gradually as you push it, it'll go, oh, I understand. I'm supposed to let go and let that fluid go. And then it will go. But so if you discover sore spots, don't be surprised.
Okay.
And just gently from the far side towards the center.
And just keep in mind that whether it's on your chest or even your back or even under your armpit, it's all gonna go into that armpit.
Okay.
And even this is gonna go into the armpit, into the armpit, into the armpit, into the armpit. So I think about the armpit as being the inside of a star. And then I bring the star, do you see how I'm making a star into the armpit?
So everything's going
Okay. Not so much this way.
Nope, nope,
No,
nope,
this
nope.
is not right. What you're doing.
Towards the armpit.
Towards the armpit, not up. This way. Look, you're doing this. Do this. You're going to the armpit.
There you go.
Now it's right. Because yeah.
That's funny. I do it thinking I'm doing it the right way and I just haven't.
Well, that's
thought-
okay. That's why you're here.
So into the, there you go, into the armpit.
Remember, you went all that trash in the pit.
Yes.
Into the armpit.
Okay.
That's right. Now you're doing it right.
Okay, good. And you may want to do it in front of a mirror, or you can turn on your camera and just, you don't have to record. The camera will still show you and you can see what
Right,
you're
right.
doing.
Good idea.
And then you can, you know, see, nope, that one, the last one, you brought it down like this instead of
Okay.
this. Yes, there you go.
That's right. Down to the
Good.
pit. Down to the pit.
Because I will tell you, I've had a lot of training in this and I had surgery and I realized as I was doing some of it, I was actually disoriented to the point that I was going the wrong direction just because that area of my body felt numb.
Mhm.
And so I was like, what am I doing? So it's one of those things that it's very helpful to have a mirror, to have a camera, to have something where you're getting feedback on what am I doing?
Okay.
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 All right, so have you still continued with your exercises? We haven't forgotten.
I'll go. I've got an appointment with you Thursday because I'm gonna have to leave early anyway. So I'll see you Thursday.
Are you doing your
afternoon.
homework?
And I can do those things at home, like whatchamacallits and that, so yeah.
Okay. All right.
Thank you.
I will miss working with you.
Well, so will I, because you do make me do it better, but I will do them at home.
Okay.
Yeah, we just have a minute to go anyway. I think we started at 2:10.
Yeah.
So I've
Okay.
been doing the stretching. Yes,
Yes.
it's very slow going, so.
And that is
Yes.
fine. It's going
Okay.
to be, you really, I can't emphasize this enough where it's like, listen to your body. So if your body says, that's what I can do, that's what you're gonna do.
And
Okay.
if you do something and you get to pain,
So
stop.
keep, oh, I can't hear.
If you do something, like raise your arm and it causes pain, stop, back off.
Okay,
Don't go, oh, I'm just gonna go a little further. If it's hurting, you're going too far.
okay.
Just go up to where it's okay and then stop.
Did you
Repetition.
have nerve pain? Because I'll
Oh,
do.
yeah. Oh,
Yeah.
absolutely. Absolutely. All down this arm, all the way down. Oh, yeah. It was miserable.
That's what scares me. It's like I'll feel something, it'll be like this shooting pain, and I'll be like,
Oh.
oh,
Now, that's the inflammation. And as you move, all that fluid's in there already. And when you move, it creates pressure in different places depending on which way you move. And so you move this way and there's pressure on this nerve over here, and you move this way and there's pressure on this nerve over here.
There you go.
So you're going to get different pains going different ways depending on which way you move.
It is so
Okay.
much more productive to keep that, the direction becomes crucial. And the direction is always into the armpit.
okay.
The more you work
There
that-
you
yeah,
go.
that's good. And the more you work the fluid out, the less fluid.
Oh,
you're
I
working.
can't hear now.
So the more you can work that fluid out like you're doing, obviously the less fluid there is, and the less fluid there is, the better it feels. And the less
Okay.
pain.
Okay. What about taking anti-inflammatories?
If you must, I'm not gonna tell you I don't. I do at times when I must.
I'm the nurse practitioner, I'll tell you yes.
You say yes.
I'm the nurse practitioner, I'll tell you yes, take some anti-inflammatories.
So it's one of those things that becomes a balance because living in pain is so miserable. So I really work to minimize my medication by using the essential oils. So like the copaiba, some other oils that are super good, that doTERRA has a product called turmeric duo capsules.
Okay.
And these are fabulous because most turmeric, almost all turmeric just has the powder turmeric. It doesn't have the oil, and the two parts work together to get more anti-inflammatory properties. So, because you get two different molecules in there that are able to mix, and then you get better results from the turmeric duo capsules.
Okay.
And I can see if I will find you the link for that and send that to you, because I had one guy who was dealing with wicked swelling. And again, we're working on Zoom. He's in another state, and he had wicked swelling in his legs. And he said, I will take turmeric dual capsules the rest of my life, because he said, if I don't take them within a day or two, I am so swollen. So, like I said, I'm not going to tell you I don't take anti-inflammatories, because I do. But I try to minimize their use because they can be so hard on my stomach.
But turmeric is a natural anti-inflammatory. It's well researched. And it's
Okay.
been proved that the turmeric, and this is a dual, it's a combination with another herb. And it actually there's research that shows those two herbs together actually do help reduce inflammation.
So would I stop taking the copaiba to be able to take the turmeric?
When you're back here,
It just feels good. It's like, oh, I need relief.
so
Okay.
when you're starting in the middle, you're going to the back.
Okay.
Okay, and then I'm gonna come here and go to the back, and there and go to the back.
So I'm coming toward the armpit.
To the
Yep, think I'm going to the armpit. So I have a line, my seam lines up well with it. It's called a watershed, and everything on the front of that line is gonna come here. Everything on the back of that line is gonna go here. And that's why it's very helpful to have somebody else who can do some of that for you.
Right, okay.
Okay?
Okay. Thank
I'm gonna be real personal here just for a minute. My husband will sit down in like the lounge chair, and I'll sit down in almost in his lap, like between his legs, and he'll sit and do that for me while we watch TV for a little while. And it helps
Okay.
so much, he's doing it and he's watching TV and he's good, So,
Okay.
and I'm thrilled. So it works that way.
Yeah,
too.
you
do
could
that.
sit on the floor. That works too, and then he can sit in
Okay.
a chair. So then it's not quite, I mean, I'm in shape for it, so I can do it for hours, and I do it for hours. So,
Right. Right.
but it's an energy intensive. So, yeah, I'm gonna turn off the recording. Well, do you have any questions before I turn it off, just in case we want to catch any of the answers on here?
Just about what exercises I should do for the next 48 hours. Let's
So
see.
I'm gonna add pendulum to your program where you lean forward and I'm moving my body. I'm shifting my weight and my arms just relaxed and swinging.
My good arm or bad arm?
Your bad arm, your injured arm. So I'm just gonna let it relax as much as I can and let it wobble around. And I can do circles, I can do plus signs.
And she's creating the impetus for the movement with her torso.
Yeah, with my hips, I'm actually
Mhm.
shifting my weight back here on my hips and just letting my arm relax.
The arm needs to be completely relaxed and let the torso and the hips do the swinging.
Got it.
Good. Now, when you change directions, just let your arm hang there and become quiet, and then start moving on your feet again. Start moving your pelvis on your feet to start swinging the arm. There you go.
That's right.
Because the arm should be as relaxed as possible, and you only make the movement as big as you are able to comfortably do that.
And when
Yeah.
you get tired, rest,
Okay.
which may be often at first, especially.
Yeah,
Yeah.
and do it like 3 or 4 times a day. Just, it actually, most people tell me it makes their shoulder more comfortable.
Okay. And you said not to be concerned that my shoulder seems to be pronating or whatever it is coming
Nope,
forward.
nope. We're not, I mean, you can do, because we talked about the shoulder blades down and back.
Yep.
And so that is a good activity to do, but not while you're doing this activity. You do one or the other.
Right, right. Okay. Yeah. Just down and back, just enough to kind of stretch it, right? Without it hurting too bad.
And just like letting it relax and letting the circulation kind of move around through there. And then you remember on the pulley, we did straight up in front. We did
Yep.
somewhat out to the side.
Yep.
You can do a little pull up in the back. Like that.
Oh,
Did-
is your arm bent on the back?
If you
Yeah.
can.
Let me show you, if you can, because a lot of people,
May not.
they start here. That's as far as they can go, and then they start to be able to pull it up all the way to here.
Yeah.
But
I
you're
used to
gonna
be able to go
start-
higher. And I had that PT session and it just, whew.
No, you're not gonna do that. Do not push into the pain. No pain, no gain only works if you don't have tissue damage, and we know there's tissue damage, so you're not gonna go there.
Right.
Before it hurts.
You know, when it's like, ooh, I can feel that, that's where you stop, not, I can,
Right.
okay? So
then
real
the-
gentle.
The third stretch with the pulley, I've been doing this one. I can't go all the way 90, but going up.
That's okay.
No, it looks pretty good.
Okay.
Yeah.
Well, Mary's gotten my rotation back. It was incredible.
Yes.
So can you Did the pulley come with a little booklet with movements in it? Because most of them do.
With a website that I can look at. The pulley came with this other, but it just one that showed a picture of him doing something that was not on your list. So I have not done that. I was like, that looks like it would hurt me.
Yeah, that's probably why I didn't give it to you, because I didn't give you everything I know. I gave you the things that I thought you could do and not go.
Right. Yeah. Okay, so I'll keep doing the
You can do
pulley.
moist heat. I prefer moist, gentle heat, not like, oh my gosh, that's so hot, but a little gentle heat. And
Okay.
I think with the turmeric link on doTERRA, I'm probably also gonna send you the lemongrass link. The lemongrass is really, really good to support lymphatic flow.
I didn't know that.
Yeah.
I had no idea. You never told me that before.
Yes, I did in the
Oh,
class. You even ordered some.
Okay, that was a long time ago. Oh, my.
You came to the class and
I
you're like, I
did.
need to get the lemongrass. And I was like, you do. So the
Okay.
lemongrass is super.
What about icing? I tried icing once this morning and I mean, it kind of feels good, but it's like, I feel like I'm tightening up.
So, this for post-injury, I don't really encourage people to use ice unless there's somebody that's like, oh no, I just love ice. It feels so good when I use it. So, I'm kind of lean more to heat, but the other thing I lean to is closing your eyes, visualizing your shoulder and saying, what do you want? Do you want some ice? Do you want some heat? And seeing how it responds.
Okay.
And if it says, I want ice, and you're like, oh, okay, I'll put some ice on you. But it might also be, no, I want the heat.
Mhm.
Heat,
Okay.
gentle, mild heat helps move lymphatics. Really hot heat creates more swelling, so
Right.
don't use really hot heat. You want a mild sensation of heat, warmth.
Yeah, it's like think when you get a burn, how it swells up around the burn because it's too hot. So mild, moist heat. Have you ever seen the rice bags that are heating, like heating bags that have
Yes.
rice in them? You can take those and you can moisten them on the outside and put them in your microwave for just a minute. And those make wonderful moist heat, but just be careful not to get too hot. And a
Okay.
towel between it and your shoulder and your skin.
Okay. Perfect.
And I would use the essential oils. I would wait at least 10 to 20 minutes before I put any oils on your skin after you use heat, because you open up the pores and it can irritate your skin.
Okay.
That's right.
Okay.
And for about 10 to 15 minutes max with the heat.
Oh, okay.
Yeah, don't leave it on forever. It's not good.
Like 3 times a day?
You can, if you have the time to do it, it's awesome.
Okay. I
They
usually
Make those rice bags where they'll just lie over your
I
shoulder.
actually
They're big
sell
and
them here
flat.
in my
Oh, do
office,
you?
but you're not here, so I would get it off Amazon,
Yeah.
because for me to ship it to you is going to take longer than it will take for Amazon to get it to you. So get it from
Yeah.
Amazon.
So
But
is
they
it
make-
enough to just heat like this, or should I also be doing this? Because usually my pain is on the
Well,
side.
you get one that's a wide one and
Uh-huh.
just lay it over the whole
Drape it
thing.
over the whole
They
thing.
even make some that look kind of like tees, where part of it goes in the front and part of it goes in the back and part of it comes down this
Yeah,
way.
on Amazon, do a search for shoulder heating pad
Okay.
or shoulder rice bag or something
Mhm.
like that. And they'll have a shoulder, they make them in shoulder shapes.
Mhm.
Right. Okay. Sounds good. Thank you very much.
You
will-
are.
One more
very
thing I
welcome.
have to tell you,
Yes.
as a patient with the same problem, patience.
Okay.
Lots and lots of patience and diligence, but mainly patience.
Well,
Okay.
I'm hoping that you don't have frozen shoulder. I mean, it's honestly not a classical frozen shoulder pattern. Yeah, it's not a textbook frozen shoulder pattern.
Okay.
And so the movements, you can still do the body power system movements. And if you're too sore in your right shoulder, just do the movements on your left side and don't even test them. I did that where it was like, okay, I'm going to do the movements, but I'm not going to test my hard side. And I didn't test my hard side for 3 weeks. And then I retested. And I was like, oh my gosh, that really worked. And
Oh, cool.
so
Okay.
don't even worry about necessarily testing. If you're like, man, my shoulder is just really hurting, just don't test it.
Okay,
But do the movements on your other side.
okay, sounds good. Thank you very much, Mary.
Okay,
All right, we'll see you Thursday.
all right. Oh,
Okay.
let me look at the schedule and make sure. I want to verify that you're down,
Okay,
because we've had some changes around here and I just want to verify. Because like that last lady, it was a snuffle because I really thought, yeah, it was weird. Yes, I do have you on Monday or on Thursday at 4, which is 2 your time.
yes, correct.
Okay. And
Okay.
and again, you can text or email questions. I'm trying to keep up with everything, but yeah, sometimes it's a little overwhelming,
Yes.
which is okay. All right, you don't know what you're capable of until you're asked to do it.
Right. I understand.
Okay, and